They told you it wouldn't happen for decades. They were wrong. In 2025, Stanford released a bombshell. AI now outperforms human doctors in diagnosing 26 major diseases, with accuracy rates hitting 96%. The system doesn't sleep. It doesn't forget, and it learns faster than any physician ever could. Hospitals are quietly deploying these systems behind the scenes. Your next medical scan, already reviewed by AI, sometimes before a human ever sees it. Your blood test results, parsed by algorithms with genomic-level insight. Your diagnosis, increasingly, it doesn't come from a doctor at all. This is no longer the future of healthcare. This is your present, and it's being built by a $350 billion AI medical industry moving faster than any government, any hospital system, or any doctor can keep up with. So the question isn't if AI will replace your doctor. It's, are you ready for what happens next? Every year in the US, nearly 800,000 people die or suffer permanent disability from one cause alone. Diagnostic error, that's more than stroke, more than Alzheimer's, more than every car crash, homicide, and suicide combined. The healthcare system isn't failing because of bad intentions. It's failing because humans weren't built for this level of complexity. 15-minute visits, thousands of diseases, tens of thousands of papers published each month. The average doctor simply cannot keep up. And now, artificial intelligence is proving it doesn't have to. Deep learning systems trained on millions of patient records are diagnosing lung cancer, heart disease, diabetic retinopathy, and dozens of other conditions, more accurately and faster than human specialists. Over 950 AI-powered devices are already FDA cleared. ADOC, Tempus, Google Health, and DeepMind have begun the quiet takeover of clinical decision-making. And patients? Most have no idea they're already being treated by machines. But they are. And the early data shows that might be the best thing that's ever happened to modern medicine. To understand why AI is taking over diagnosis, you need to understand just how broken the system already is. According to the OECD, up to 15% of all diagnoses are wrong, delayed, or incomplete. In the United States alone, 12 million people are misdiagnosed every year in outpatient care, and nearly 800,000 suffer death or permanent disability as a result. That's not a bug in the system. That is the system. So what's causing this? 1. Testing failures. Nearly 70% of diagnostic errors happen during routine testing, ordering the wrong test, collecting the wrong sample, missing results, miscommunicating findings, and none of it is intentional. It's just too much complexity for any one human to manage consistently. 2. Cognitive bias. Doctors are trained to think fast under pressure, but that leads to anchoring, confirmation bias, and narrow diagnostic focus. Studies show that once a doctor forms an early impression, they rarely revisit it, even when new symptoms emerge. 3. Communication breakdown. Up to 70% of diagnostic errors involve miscommunication between nurses and doctors, between radiologists and referring physicians, and worst of all, between doctors and patients. Now combine that with a workload crisis. Doctors are burning out, hospitals are understaffed, and every minute lost is a life at risk. This is the hidden engine behind AI's rise in healthcare. It's not just about cost, it's about survival. Because when lives are on the line, a 15-minute delay or a misdiagnosis is fatal. And in that world, the doctor who uses AI will always outperform the doctor who doesn't. Let's be clear, AI isn't catching up to doctors. It's already ahead. Take lung cancer, one of the deadliest and most commonly missed diagnoses in medicine. AI models now detect malignancies on CT scans with 94.6% sensitivity and 93.6% specificity, surpassing even the most experienced radiologists. And this isn't in a lab. This is in clinical use. Every day. At Google Health, the AI reads scans, flags nodules, and compares year-over-year changes, instantly. It never gets tired. It never misses a pixel. And its error rate is already lower than a human's. Now look at pathology, where AI systems review digital slides of biopsy tissue. A sweeping meta-analysis of over 150,000 pathology images found AI matched or exceeded pathologist performance across the board. Gastrointestinal cancer, 93% sensitivity, 94% specificity. Urologic cancers, 95% sensitivity, 96% specificity. Breast cancer, 83% sensitivity, 88% specificity. And when humans work with AI, accuracy skyrockets. At MIT, pathologists aided by AI reached 94.6% accuracy on complex metastasis detection, up from 88% on their own. Then there's cardiology. Oxford's Ultramics AI now diagnoses heart disease from echocardiograms more accurately than human cardiologists. And in eye care, FDA-approved systems like IDXDR detect diabetic retinopathy autonomously, with no human intervention, at 87.4% sensitivity and 89.5% specificity. And with over 950 AI-powered devices already cleared by the FDA, most of them in radiology and diagnostics, it's no longer a question of whether AI can outperform doctors. It's a question of how long we'll keep pretending it doesn't. If you've had a scan in a major hospital recently, you've already been diagnosed by AI. You just didn't know it. Take ADOC, a radiology AI that runs silently in the background of over 1,000 hospitals. It scans every CT image in real time, flagging emergencies like brain bleeds, strokes, and lung collapses before the radiologist even opens the case. It doesn't replace doctors. It prioritizes them. So the most critical patients are seen first, not last. Or consider Google's DeepMind, now reading retinal scans with expert-level precision, while explaining its reasoning in plain English. It's not just accurate, it's interpretable. That's solving one of the biggest barriers to AI in medicine, the black box problem. Then there's Tempus, an AI genomics platform quietly embedded in cancer centers across the U.S. It analyzes pathology slides to predict tumor mutations without genetic sequencing. That's right. AI is learning to read DNA just by looking at a slide. It can identify biomarkers like microsatellite instability and homologous recombination deficiency in seconds, enabling targeted therapies that would otherwise be missed. All of this is already approved, already deployed, already saving lives. The AI revolution in medicine didn't start with a bang. It started with a whisper. In the background of your hospital, your clinic, your scan. And by the time you notice it, it's already everywhere. Behind every AI diagnosis, there's a tidal wave of money. In 2025, the AI healthcare market hit $21.6 billion. By 2029, it's projected to exceed $72 billion. But that's just the surface. According to McKinsey and CB Insights, AI applications in medicine, from diagnostics to drug discovery, will generate $350 to $410 billion in annual economic value by the end of this year. Where's all that value coming from? Faster diagnosis means fewer hospitalizations. More accurate scans mean fewer repeat procedures. Earlier detection means better outcomes and lower costs. This isn't just improving care. It's redefining the economics of healthcare. And investors are paying attention. In 2024 alone, Global spending on AI in health topped $2.1 trillion, with major players driving the surge. Google is integrating AI into diagnostics, genomics, and maternal health. Microsoft is embedding AI assistants into the Epic EHR system, used by hundreds of hospital networks. Amazon is using AWS to power cloud-based diagnostics and real-time clinical support. But it's not just big tech. Thousands of startups, like PathAI, Viz.ai, and Caption Health, are carving out specialized niches in imaging, triage, and cardiovascular diagnostics. And regulators are keeping pace. The FDA has cleared nearly 1,000 AI-enabled medical tools to date, and 15% more in just the first half of 2024 alone. This isn't hype. This is infrastructure. The global healthcare system is being rewired in real time, with algorithms replacing intuition and precision replacing guesswork. And the $350 billion question isn't if AI will take over medical diagnosis. It's who will control it. You don't need to visit a hospital to be diagnosed by AI. In fact, you don't even need to leave your house. Let's start with your skin. Apps like Skin Vision let you photograph a mole or lesion and get a risk assessment for skin cancer in under 20 seconds, with sensitivity up to 95%. No appointment, no waiting room, just your phone and a camera. Then there's Ada Health, a free AI symptom checker used by over 12 million people. It analyzes your inputs in real time to offer potential diagnoses and triage recommendations, often with accuracy comparable to a primary care doctor. Platforms like Babylon Health have already partnered with national health systems. Their AI triage chatbots now handle millions of consultations across the UK, cutting average wait times from 2 weeks to just 2 hours. These tools aren't just consumer toys. They're certified medical devices in many countries. But it goes deeper. Services like Inside Tracker and Viome analyze your blood, stool, and even gene expression data, using AI to detect early signs of chronic illness before symptoms appear. Inside Tracker calculates your biological age and gives you personalized biomarker targets based on longevity research. Viome uses RNA sequencing to monitor over 100 million biomarkers, guiding diet and lifestyle interventions with clinical-grade precision. This is precision medicine, delivered direct to consumer. And as these systems evolve, they're collapsing the distance between specialist-level insight and everyday access. That we are entering an era where you are the point of care. The AI doesn't just come to the clinic. It comes to your phone, to your blood work, to your mirror. And it's not asking permission. AI isn't just faster. It's cheaper. Radically cheaper. Let's compare. A traditional dermatologist visit for a suspicious mole? $300 and a 2-week wait. An AI-powered scan through Skin Vision? $30 and results in 20 seconds. A GP visit to discuss flu symptoms or fatigue? $45 to $150, plus the wait. Ada Health's AI triage? Free. Instant. Available 24/7. Genetic risk profiling through a hospital? $3,000 and 6 weeks. With AI-based analysis platforms like Inside Tracker or Viome, $249, with results in under 3. This isn't incremental change. It's a 10x reduction in time and cost. Why? Because AI scales like software, not like humans. Once trained, a diagnostic AI system can run thousands of evaluations in parallel. It doesn't tire. It doesn't miss lunch breaks. And its marginal cost is near zero. That means universal access isn't just possible. It's economically inevitable. We're witnessing the commoditization of medical intelligence. High-quality diagnostic care is no longer a scarce resource limited to top-tier hospitals. It's a cloud-based service, delivered globally, at scale, the same way Google democratized access to knowledge. AI is democratizing access to diagnosis. And in a system plagued by waste, error, and inequality, this shift isn't just beneficial, it's revolutionary. Of course, this isn't science fiction. It's medicine, and medicine lives under the microscope of regulation for good reason. So, how do you regulate an algorithm? In 2018, the FDA approved the world's first autonomous AI diagnostic system, IDXDR. It could detect diabetic retinopathy without a human in the loop. That was the first domino. By 2025, over 950 AI-powered medical devices have received FDA clearance, most of them for radiology, pathology, and cardiology. But AI isn't static. It learns. It evolves. Which raises a thorny question. How do you regulate something that improves itself? The FDA answered with a new framework, predetermined change control plans. This allows approved AI systems to adapt within pre-validated guardrails, without resubmitting for full review every time they improve. Europe followed with the AI Act and updates to the medical device regulation. These policies mandate transparency, explainability, and ongoing post-market surveillance for AI-driven healthcare tools. But even with oversight, the black box problem looms large. Many AI systems, especially deep learning models, are inscrutable, even to their creators. They may be accurate, but they can't always tell you why. That's a problem in medicine, where decisions can mean life or death. Researchers are now building explainable AI systems, ones that show their reasoning and highlight the features they used. Google's DeepMind has pioneered this in ophthalmology, offering diagnostic confidence maps to help clinicians trust the AI's decision. Because in medicine, it's not enough to be right. You have to know why you're right. And as AI becomes embedded in clinical workflows, regulators, clinicians, and patients will demand transparency. Precision must come with accountability, and algorithms must earn our trust, one diagnosis at a time. So where is this going? By 2026, over 65% of hospitals globally are expected to deploy diagnostic AI. By 2030, that number could exceed 80%. This isn't just about adoption. It's about transformation. AI will expand beyond images and pathology. We're entering the age of multimodal diagnosis, where patient history, genomics, blood biomarkers, wearable data, and even environmental exposures are fused into a single diagnostic model. Instead of separate tests and second opinions, you'll get a holistic AI assessment in real time. On the regulatory front, global harmonization is accelerating. The FDA, EU, and other health agencies are aligning standards to support faster approvals of adaptive AI models without compromising safety. And the economics? AI in healthcare is projected to cut costs by 8% globally. That's trillions in savings, while simultaneously improving accuracy and access. Imagine a future where misdiagnosis becomes rare. Access to expert-level care is instantaneous. AI collaborates with physicians, not replaces them, but lifts them to superhuman capability. This isn't utopia. It's a 5-year roadmap, and healthcare is only the beginning. The future of diagnosis isn't a decade away. It's already in the hospital, in your clinic, and soon, in your pocket. AI doesn't get tired. It doesn't miss lunch. It doesn't get rushed during a double shift. It sees what the human eye can't. It finds patterns the human brain overlooks. It doesn't replace your doctor. It replaces their blind spots. And for the first time in medical history, we're facing a diagnostic system that actually improves with every patient it sees. This is not just an upgrade. It's a paradigm shift. A $350 billion industry is rising on the back of this transformation, driven by algorithms, data, and precision. The institutions that embrace it will lead. Those that don't will fall behind. Because in this new era of healthcare, the smartest clinician isn't just the one with the most experience. It's the one working side by side with a machine that never forgets and always learns. This is the new second opinion, and soon it will be the first. If this episode made you rethink your next doctor's visit, you're not alone. The age of AI in medicine is no longer on the horizon. It's here, and it's diagnosing faster, more accurately, and more affordably than ever before. But this is just one piece of the Bioforge AI story. In our next episode, we'll show you how CRISPR 3.0 is not just editing DNA, it's erasing inherited disease entirely. And the medical establishment? They're panicking. So if you want to stay ahead of the curve, where biology meets machine intelligence, subscribe to Bioforge AI. New episodes drop every week. And trust me, you won't want to miss what's coming next. Because the future of medicine isn't coming. It's already rewriting your biology.